Move aside. Move aside. Let the ambulance through. Please move aside.
Welcome to the Ambulance World Podcast, where we make EMS connections across the globe. Now, here's Evan.
Hi, everybody. This is Evan over at ambulanceworld.com. Thanks for joining us today. This is the second podcast that I'm editing for the day, so this has been a long day. This is actually the sixth in the series of podcasts that we've done so far. So far we've done Egypt, Thailand, UK, Saudi Arabia, and I got 2 from Israel. And I got a couple other lined up for next week. It's going to be kind of cool stuff. So on our 5th podcast, we interviewed Chaim Rafalowski, who's the Disaster Preparedness Coordinator for MDA, which is the Israeli National EMS Service. And today we have with us a gentleman by the name of Eitan Charnoff. Now, Eitan is originally from the United States. He's from the Washington, D.C. area. And he moved to Israel, going to college there. I think he's actually graduating the next day or two from college. And he's been a volunteer EMT there since 2008. It's 2012 now, so he's been doing that for 4 years. He has a lot of insight to what's going on to EMS in Israel, able to contrast it to the United States because he's got a little bit of EMS experience here as a volunteer in the United States before he did move to Israel. Has a lot of explains how the training works and the certification levels. But the thing that is really I'm very happy to have him talk about is a group that he's involved with called EVP, and it's called Emergency Volunteers Project. He corrected me in the interview, which was kind of funny. I said Emergency Volunteers Program, and he corrected me. Emergency Volunteers Project is a program in Israel. It's where they're gathering volunteer EMTs, paramedics, firefighters, doctors, and nurses to come and train in Israel once annually and be involved in any disaster response as it occurs in Israel. They're looking for experienced people, and for a lot of our listeners here are people that are interested in either going abroad, you're experienced medics looking for new experiences, and this may actually be the one for you. They make arrangements for you to travel to Israel, and as I understand it, you don't pay for any of that, you're just volunteering. You can check with them to work out all the details, but so you get to go to Israel. It's about 10 days or 2 weeks once a year to train, and then they're putting go teams together in various places, not just in the United States but in the world. So Australia, UK, South Africa, they have go teams that are of firefighters, EMTs. So in the case of a disaster, you would go and help out there. But until that happens, or hopefully it never happens, you get to train annually in Israel, and kind of cool stuff. So it's an opportunity to experience EMS in other countries. And Israel's got a really premier EMS system, which is the things that you're going to learn there just to bring back to your home systems is going to be very valuable. So anyway, so that's it. So I'm going to introduce you to Eitan Charnoff. What I am going to tell you is, so this interview, I'm working out some of the glitches on this, since we're kind of new to this, on the sound quality and the video quality on doing these interviews. So sound is a little bit glitchy. It's not super, but you certainly can understand what's going on. I had to send the video out to a professional audio mixer person who had to play around with the sound levels. I got to figure out a little bit of a better way to do this, but right now we're recording the videos using Skype to Skype or Skype to cell phone, and I just switched. I was using ScreenFlow, and now I'm using a program called Camtasia. It's a screen capture, video sound editing program, and I like it a lot better than ScreenFlow. It just seems really simple and user-friendly. So although I recorded this in ScreenFlow, I'm doing this subsequent editing in Camtasia. So I think from now on I'm going to use Camtasia, and that hopefully will help fix some of the sound problems. So we're going to go and we're going to talk about EMS in Israel with Eitan Charnoff. So here you go. Hope you enjoy it. Welcome everybody to the Ambulance World podcast, and we're fortunate to have Eitan Charnoff And we have him here on Skype from Herzliya, Israel. And Eitan's going to be talking to us about EMS in Israel. And he's actually originally from the United States, so has a really good perspective on differences between EMS in the United States versus in Israel. He's been there since 2008, and he'll talk about that a lot. And he's involved with an organization now called the Emergency Volunteers Program, and it's going to be an opportunity for all you guys listening in to maybe go over to Israel and learn and train and volunteer with the Israeli EMS and fire services, and we're going to talk about that. So, Eitan, welcome.
Thank you. Before we go on, I just want to correct one thing you said.
Oh, I'm sorry.
It's called the Emergency Volunteer Project, not Emergency Volunteer Program. So if people are going to go and search this online afterwards, which hopefully they will, just search the right thing, Emergency Volunteer Project.
Okay, well, I stand corrected.
It's fine. That being said, as you said, my name is Eitan Charnoff. I'm originally from Potomac, Maryland, and I first got involved in EMS by volunteering in high school. In a local volunteer fire department. Then in 2008, upon graduation, I moved to Israel, and I've been a volunteer medic here for 4 years. A medic here is basically the equivalent of an EMT in the States, with the added skill set of being able to put in IVs and under certain circumstances give a limited number of drugs.
Okay.
I'm now the representative for the DC chapter of the Emergency Volunteer Project, which is something we'll be explaining a little bit later on in the video.
Oh, well, it sounds like you have a pretty busy life right there. So maybe I'm gonna ask you. I want to learn about the Emergency Volunteer Project, but we're gonna hold off on that just momentarily, if you don't mind. I want to find out a little bit about EMS in Israel. And so a couple things. You said that there's a difference that your title is medic, not EMT, and it sounds like your scope of practice is more analogous to an EMT intermediate. Is that in the United States? That sound about right?
I would still say I'm closer to the end of an EMT. I don't have some of the more sophisticated skill sets like reading EKG.
Okay.
I can't put in an intubation tube. I can give drugs under the supervision. I put until recently give drugs under the supervision of a paramedic.
Okay.
That's no longer the case. And the drugs we can give are far safer as a medic, which is again to give aspirin. Max casualty adrenaline as well. Additionally, we can give glucose, which I believe EMTs in those states can.
Now, IV glucose or oral glucose?
Oral.
Okay.
Through IV, we can only give saline.
Okay.
But again, I know from my experience in Montgomery County, Maryland, that's something EMT can't do.
That's correct.
But I would still say we're closer to the end of the EMT.
Oh, okay. So that's kind of nifty. Now, you said that until recently you were able to give some medications under the supervision of a medic. Did that change?
Yeah, about a year ago they changed the policy, and now only EMTIs and EMTs in Israel can give drugs. But I'll explain if you want. I can go into the structure and skill sets here versus the States. It's a little bit more complicated.
Yeah, that would be awesome. Yeah, go ahead. Yeah.
So I'll first go over these states. I'm sure most people know. We have the EMTB, which is the EMT basic, EMT intermediate, which is usually called a medic, and the EMTP or a paramedic. So our paramedics, which is the highest training level under a doctor, is very similar to those in the States, with a few minor exceptions. They can put in a decompression needle, and I know in some states in the States that's not allowed. But because Israel is a small country, we have the same rules everywhere in the country we go, which has some added benefits I can explain later as well. But back to the level, so I'm going to work my way down each one. So we have the EMT. Under that is the EMTI. The EMTI, unlike in the States, can't staff an ambulance by himself. He has to be on an ambulance with the paramedic, but he can assist in most of the advanced procedures that the paramedic does. Then under that, we have the EMTB, which we call medic, which are the skill sets I already described. It's basically the EMTB with the ability to open veins. Underneath that is where things get complicated. We have two levels under EMTB or med in Israel. One is called the senior first aid responder, and then our first aid responder.
Okay.
These are primarily ranks that we give to our youth volunteers in Israel. People in high school, students in high school from the age of 16 and up volunteer on our ambulances. And they go through a 60-hour basic training course, which we call first aid responder. They can assist on the BLS ambulances with basic medical procedures like checking blood pressure, performing CPR, and stuff like that. The senior first aid responder is an 88-hour course in which they learn how to open units as well. And it brings them to a very close practical level of the EMTB minus some of the clinical knowledge.
Oh, so, okay. That's not too distant. In the United States, we have that kind of first responder, EMT basic, intermediate, and paramedic. So not...
We didn't have first responders, so I'm not familiar.
Oh, okay. Yeah, there is a first responder certification that a lot of places don't really use, but it's there. So let me ask you. I know that in one of the terms that EMS providers hate is ambulance driver, and I know that there are guys in Israel they're just that. They're just ambulance drivers. Is that right?
It's a misconception. The ambulance driver in Israel is the head of the unit. So it's not just an ambulance driver. That's actually a misconception. It's not true at all.
Okay.
In fact, it's the driver that's in charge of all medical decisions. Now, in all practicality, the person in the back is the one calling the shots, but the driver is technically the one in charge and responsible for everything that went on inside the ambulance. He's usually the senior personnel, unless it's that's in the case of a BLS ambulance.
Okay.
BLS ambulance, obviously, there's a paramedic in the back.
Okay.
But in short, that's not true.
Oh, okay. So I'm staying corrected. Outstanding. So when you trained in Maryland as an EMT basic, correct?
I didn't get to finish the course because I had moved.
Oh, okay. So you had to start and do the course from scratch in the United States. I mean, in Israel. Excuse me.
Yeah, I did. And to be honest, because the practical our protocols are different in Israel, I would have had to take the course either way.
Now, since you did do some of the course in the United States, though, right?
Yeah, I mean, I took some of the basic courses in local.
How did you find the training was different?
So I can't speak so much to the training differences, but I can tell you about the practical differences in the field, which are pretty fascinating.
Okay.
In Israel, there's not the same culture in the United States. In the U.S., there's a lot of fear over lawsuits and malpractice. In Israel, there's not really as much of a concern for that, and as a result, we can get more invasive treatment in the field. That's actually the point where we don't transport or we don't perform CPR while driving the ambulance. We stop the ambulance on the side of the road and perform CPR because we believe effective CPR is done in a stable environment.
Okay.
And our ALS units can perform any resuscitated hospital in the field.
Okay.
So it's essentially pointless for us to compromise the quality of the CPR on bumpy roads. That's the biggest difference, and that's the difference whenever I go back to the States and people ask me, how big's the difference? That's the biggest thing for sure, because it's hard for Americans to wrap their head around not driving and performing CPR at the same time. Another difference is the way we do CPR in Israel. In Israel, we have a device that I don't believe the Americans have approved for use. It's called a cardio pump. I wish I had one with me.
Is it a machine? It's like a hydraulic machine that does CPR itself?
It's not a pumper. It's actually a manual pump that holds like this.
Okay.
And it has a suction pump on it.
Okay.
And it supposedly helps with decompression of the heart and allows for better refill of the heart chambers, and thus allows for better circulation. It's tiring to use, but I mean, again, I can't speak on an academic level, but I think it really is effective.
Okay.
So that's another big difference. It's a lot of it revolves around CPR. CPR in Israel works with the CPR in the States because the tools we use and the level of treatment we provide. There are other minor differences, like I mentioned. We do more invasive procedures. BLS units can check blood sugar, which in many states isn't allowed in the U.S. But I mean, at the end of the day, we're paying patients in the hospital, keeping them alive, and I'm not gonna lie, it's simple.
How about the structure of the service? How do you find that by comparison?
So it's simple because again, there's one national service across the entire country. Which, to give people some perspective, Israel is roughly the size of New Jersey. So let's say, again, I'm from the Washington area, so we think in these terms. Let's say, God forbid, a terrorist attack in Washington, D.C. So we're going to have people responding from Washington, from Montgomery County, which is designated Area 7, and never mind, that's not important. Like, in short, we'll have people responding from D.C., Maryland, Virginia, and different counties in D.C., from Maryland and Virginia. And everybody has different protocols, different skill sets, different ambulances, different fire trucks, and different equipment, and different ways of operating. It doesn't exist in Israel. Here it's simple. We have one nationwide policy. Every ambulance in the country is the same. The equipment's in the same place. It's labeled the same. The skills are the same. The protocols are the same. So, as a result, the mass casualty things are far more streamlined. Everybody knows how to work with each other. They all want service. On a day-to-day basis, how does the country work? How does the EMS system work? Very similar to the U.S. We're broken up into smaller regions. Each has their own local dispatch. There's one number for the whole country, an emergency number, instead of 911, we dial 101. But essentially, it's very similar basic structure. You know, we're broken up into regions. In each region, each city has a station or two. But they don't do their own fundraising. They don't have their own protocols. Everybody's the same. Okay.
Now, when you came to Israel, did you speak Hebrew?
Honestly, no. I learned in a Jewish school in the States, so I spoke some Hebrew, but not really totally. I learned more biblical. But I can tell you the best way to learn Hebrew is to work on an ambulance for every day for a year, which is what I did when I was got. I learned Hebrew pretty quickly. I learned the rough Hebrew that ambulance drivers speak. Okay. And learned a little bit of Russian, a little bit of Arabic. It's a great place to learn languages because Israel has such a diverse culture. The patients speak all different languages, and the personnel on the ambulance speaks so many languages.
Yeah, I'd say when I spent time in Israel, different than the United States. In the U.S., if you meet somebody who speaks 2 languages, it seems really impressive. In Israel, if you meet somebody who speaks 3, 4, 5 languages, it's kind of average.
I have a very good friend of mine. He's a EMTI. He speaks English, Russian, Arabic, a little bit of French, a little bit of Greek. It's not unheard of here. I'd say 2 languages is the norm,
right.
And 3 languages, like you said, isn't so surprising.
Yep, absolutely. So yeah, that's pretty neat. So now, did you find in that first year that you were riding on the ambulance and learning the language, that you were able to function effectively without a really good command of the language initially?
Yeah, so for me it wasn't such a problem. First of all, most of the drivers, because have vast amount of knowledge, many of the medical terms are derivatives of English words. They all speak English to some degree or another, so communicating with the crews on ambulance was no problem. Interacting with the patients took me a little bit more time until I spoke enough Hebrew to be able to get the right information out of them. But again, there's other people standing in the ambulance that can do the interviewing of the patient assessment for you while you perform the actual procedures. So no, I didn't have a problem. It's a great learning environment.
So when it came to charting, well, that must have been a little bit more challenging than the speaking.
When it came to charging?
No, charting, writing charts.
Writing charts. So everybody has a different term for this.
Okay.
I'm assuming in New Jersey where you're from, we call it charting. So filling out the paperwork, I'd say it took me about a month to be able to do. Again, I came with some knowledge of Hebrew, I knew how to read and write. Okay. And our paperwork in Israel was a lot simpler than the States. I remember in Montgomery County having to write like a page-long summary in addition to a very detailed medical form. Here we have a neat little computer. It's kind of like it's not a computer exactly, it's like a smartphone. And in Israel, because we have socialized medicine, we have an international database of everybody in the country, their medical history, their address, who's their health insurance. So all we do is enter in their ID number into our computer, and it gives us all their information. We just check that it's correct. We don't have to write long essays. The computer spits out a nice essay for us based on the information we enter. It takes about 3 minutes to do, and it gets faxed to the hospital. So it's definitely easier filling out forms here.
Well, that's awesome. Actually, it makes it a lot easier, and especially when you have patients that either are altered or somehow in distress, and they're not they're not going to give you their information readily. It makes it a lot easier.
Or unconscious.
Yep.
I mean, it's a very effective thing that we have in Israel, and I know in the States the whole idea of a medical registry, national medical registry, is very controversial. But here, there's no even question about it. It's a great system, and it works very well for this country.
So I did an interview, which is going to be posted on the website along with yours, about a week ago with Chaim Rafalowski from the EMS organization Magan David Adom, and he spoke to about foreigners coming to Israel to volunteer or to work, and explained that some of the difficulty in making that happen. That it's actually a little not a straight road, that there's a direct program, and that it was a little bit different from person to person, that they have to contact the organization, and that so this is kind of a good segue, because our listeners are a lot of people that are interested in traveling and going to different countries. You're involved with EVP, the Emergency Volunteer Project.
There you go. Yeah.
And which can help facilitate people coming to Israel to both train and assist during disasters. And maybe you can talk about that a little bit.
Yeah, so sure, I'll go into that first. I just want to explain why Israel is a great place to learn EMS. As many people know, and some don't, Israel is in a region of the world where there's a lot of conflict. We've fought a lot of wars, and we've had serious domestic terrorism problems since our inception in 1943. In the early 2000s, we suffered through the Intifada, which was years of suicide bombings in every major city of our country in Israel. As a result, we've created probably the most efficient mass casualty response system in the world. Very good at mass casualty. We drill for it all the time on a huge scale, taking hundreds of patients, not patients to the hospital, in huge drills that we perform with the Army, the police, fire department, and hospitals in conjunction. So it's a great place to learn mass casualty units in general. That being said, I'll go into the Emergency Volunteer Program was started by paramedics and firefighters after the Second Lebanon War in 2006.
Okay.
There were massive rocket barrages from Lebanon into the northern part of Israel. And they basically realized in a future war, Israel, although we have great emergency services, we don't have the manpower to respond to a future conflict properly. No country does. So as a result, we had to look elsewhere in order to supplement our lack of adequate personnel. So we turned majority to the United States, but are opening up offices all over the world, and we basically create rescue teams. We already have some from Texas, Florida, and New York, for example. And essentially, we fly them over here to Israel for a week and a half of training, very intensive training. We're looking for firefighters, we're looking for paramedics, we're looking for EMTs, even nurses and doctors. And essentially, we train them on our equipment here and on our protocols. We're taking experienced EMS and fire personnel. So we're not starting from scratch, we're filling in gaps, and we're supplementing information that's different between us and the US. And then they fly back to their home countries, and they're now part of an international rescue team. In the event of a war, disaster, natural, or otherwise, we'll fly these teams in, and they'll work on the ground with fire rescue personnel, EMS personnel, and in emergency shelters, providing really front-line rescue services all throughout the country wherever they're needed. So that's EVP in short. That's what our program is, and we're looking for really anybody with experience and the desire to learn really interesting stuff in a really interesting place.
Oh, this is awesome. So basically somebody who's got some experience, a significant amount of experience in either EMS or firefighting or medicine in general, could contact your organization, and you'll come over to Israel for a week and a half for some training, which in of itself is certainly valuable. And
people walk out with a certificate explaining the training that they did, and forget the fact that they're not part of an international rescue team. It's a nice certificate to have saying that you got disaster training in Israel.
Oh, that's awesome. So if somebody is interested in getting involved, what's the best way to do that?
So before getting involved, I say check us out. Go to our website, which is evp.org.il.
I'm going to post that and some of your videos on the website here.
Yeah, so that's the best place to get more supplemental information. All of our contact information is on the site. Instead of spelling things out, that's the best place to go.
That's awesome. Now, how many people, if I could ask, do you have a lot of interest right now in the organization?
Yeah, we do. We actually have interest from some foreign embassies in Israel having their security personnel trained by us. We're having preliminary meetings with them in the coming months. In the U.S., there's huge interest. It's not surprising that that's the case. Like I previously mentioned, Israel's a place to learn this stuff. And so people are jumping at the opportunity.
Okay, well, let me actually ask one question that's very, that I'm sure a lot of people are going to ask is, do you have to be Jewish to be involved, to volunteer for your organization?
No, of course not. Listen, Israel is a democracy, multicultural democracy. And even if it wasn't, we would still be an organization that accepts anybody. You know, we're here to save lives. And at the end of the day, that's all that matters. I can tell you that it's probably, this is off the record, I don't know for sure, but I would suspect probably 20% of our volunteers are Jewish. But religion isn't even a time of conversation. You know, it's EMS and fire. That's it.
That's awesome, and that's a kind of a brotherhood in of itself. So
100%.
Oh, that's terrific. Now, have you had some training groups come over already?
Yeah, we've had a few groups. We have, like I said, already trained, ready to go teams on standby 24/7 in Texas, Florida, and New York. And we're going to be having our next training group in October. So definitely people who are interested should get in touch with us sooner rather than later. And then in 2015, we plan on increasing the number of training we have and bringing over even more people.
That's awesome. Oh, I'm going to post all that information. That sounds a lot like, well, one, it sounds like a lot of fun. For anybody who's never been, now when the group is in Israel, do they get any time to see the country, or is it all work?
Yeah, we actually take them on a tour for a day or two to see the country. Obviously, it's a very brief trip, but once they come once, they don't want to come again. Israel is a gorgeous country. It's so small, but the topography it varies so much. You can go from desert to Mediterranean oasis to mountains to snow within an hour.
I actually read a blurb recently that they said Israel has every single climatic region that exists in the world except for two, which are tundra and rainforest.
Yep. Sounds about right to me, yeah.
So, and in a country the size of New Jersey. Are you looking... I'm sorry.
What's that?
Oh, sorry, I interrupted you.
Yeah, I can tell you I'm an avid hiker, and I was once hiking in the southern desert of Israel. My brother was towards Israel before, and he was in shock. He had never hiked anywhere like these mountains that we have in the desert. He was so impressed. So, like you said, I did that.
Yep, and if anybody's ever, opened up a Bible, it's kind of everywhere you walk is referenced in the Bible someplace.
Yep.
Which is
too.
Yeah, which is pretty neat. Oh, this is awesome. So, basically somebody who's got some experience, a significant amount of experience in either EMS or firefighting or medicine in general, could contact your organization, and you'll come over to Israel for a week and a half for some training, which in of itself is certainly valuable. And
people walk out with a certificate explaining the training that they did, and forget the fact that they're not part of an international rescue team. It's a nice certificate to have saying that you got disaster training in Israel.
Oh, that's awesome. So if somebody is interested in getting involved, what's the best way to do that?
So before getting involved, I say check us out. Go to our website, which is evp.org.il.
I'm going to post that and some of your videos on the website here.
Yeah, so that's the best place to get more supplemental information. All of our contact information is on the site. Instead of spelling things out, that's the best place to go.
That's awesome. Now, how many people, if I could ask, do you have a lot of interest right now in the organization?
Yeah, we do. We actually have interest from some foreign places in Israel having their security personnel trained by us. We're having preliminary meetings with them in the coming months. In the U.S., there's huge interest. It's not surprising that that's the case. Like I previously mentioned, Israel's a place to learn this stuff. And so people are jumping at the opportunity.
Okay, well, let me actually ask one question that's very, that I'm sure a lot of people are going to ask is, do you have to be Jewish to be involved, to volunteer for your organization?
No, of course not. Listen, Israel is a democracy, multicultural democracy. And even if it wasn't, we would still be an organization that accepts anybody. You know, we're here to save lives. And at the end of the day, that's all that matters. I can tell you that it's probably, this is off the record, I don't know for sure, but I would suspect probably 20% of our volunteers are Jewish. But religion isn't even a kind of a conversation. You know, it's EMS in fire. That's it.
That's awesome, and that's a kind of a brotherhood in of itself. So
100%.
Oh, that's terrific. Now, have you had some training groups come over already?
Yeah, we've had a few groups. We have, like I said, already trained, ready to go teams on standby 24/7 in Texas, Florida, and New York. And we're going to be having our next training group in October. So definitely people who are interested should get in touch with us sooner rather than later. And then in 2015, we plan on increasing the number of trainings we have, and we're bringing over even more people.
That's awesome. Oh, I'm going to post all that information. That sounds a lot like, well, one, it sounds like a lot of fun. For anybody who's never been, now when the group is in Israel, do they get any time to see the country, or is it all work?
Yeah, we actually take them on a tour for a day or two to see the country. Obviously, it's a very brief trip, but once they come, they want to come again. Israel is a gorgeous country. It's so small, but the topography varies so much. You can go from desert to Mediterranean oasis to mountains to snow within an hour.
I actually read a blurb recently that they said Israel has every single climatic region that exists in the world except for two, which are tundra and rainforest.
Yep, sounds about right to me. Yeah.
So, and then in a country the size of New Jersey, are you looking? I'm sorry.
What's that?
Oh, sorry, I interrupted you.
Yeah, I can tell you I'm an avid hiker, and I was once hiking in the southern desert of Israel. My brother was towards Israel before, and he was in shock. He had never hiked anywhere like these mountains that we have in the desert. He was so impressed. So, like you said, I did everything.
Yep, and if anybody's ever, opened up a Bible, it's kind of everywhere you walk is referenced in the Bible someplace.
Yep.
Which is
too.
Yeah, which is pretty neat. Okay. What was I going to ask? I kind of just when you get old, sometimes you start to forget some of the details that you wrote down. Okay, so your next trip is coming over in October. What kind of preparations or information do you need from the prospective volunteers?
Basically, we need to get in direct contact with you. We're going to meet with you beforehand. We're setting up. This is where I come in. I've been tasked with setting up a chapter in the DC area.
Okay.
I'm going to be flying out there several times for October in order to meet with prospective volunteers.
Okay.
So again, the best way is to get in touch with us through the website, and I'll be in direct contact with you. And I'll get all the information needed. Obviously, we're going to meet. We're going to want to see what your certifications are, what your experiences are, and obviously, we'll provide you with insurance and stuff like that. But it's very personal. I'm going to want to meet with you. That's how you get it.
Okay. You see, I like that because it adds a nice personal touch to it, and that's pretty neat. Oh, awesome. And how often do you plan on having these groups per year?
How often are we planning on having trainings?
Yeah, the training sessions, excuse me.
We're planning on having 3 to 5 next year, depending on how many people sign up. Now, that actually is for quite a large number of people. We can train a large number of people at this training and bring over a lot of instructors from various expertise, various expert instructors from various fields in Israel.
Okay. How large are the groups expected to be per group?
It's going to vary, honestly. It's going to vary. Somewhere between 30 to 70 people.
Okay.
Depending on what time of year.
Oh, that's awesome. I'm going to make sure to post all the information. And I'll tell you, one of the things that I like with the Israeli system, not just the experience with mass casualty, but on day-to-day just day-to-day EMS, your standard stuff, your chest pain, your shortness of breath. There's a wealth of experience, and also because of that non-litigious society, you're not so afraid of lawsuits. People aren't afraid to be very aggressive in treating patients.
I can tell you from personal experience, it's true. We provide a high quality of care, which is something I said. And it's for that exact reason. It's also, on top of that, it's the quality of education that our personnel in Israel receive is of a very, very high level. Our paramedics don't just do their job, they live their job, and they love this stuff. And as a result, they're very proficient in medical knowledge. Very comparable to the skill set of doctors in terms of the scope of knowledge.
Yeah, that's awesome. And one of the kind of the cool background stories is that Nancy Caroline, who was put together the first actual curriculum for paramedics for ALS in the country in the early 70s, she came to Israel in 1976 and started and she was the first medical director and started the paramedic program in Israel. And the National Training Academy, I think, is called the Nancy Caroline School or something like that. Which is the Nancy Caroline text, Emergency Care in the Streets, which still exists, is the premier English language EMS textbook and curriculum for both EMTs and paramedics in all English-speaking countries. I know that in Australia and in the UK as well, it's the primary text for EMS. And she's kind of the mother of at least ALS EMS in Israel, which is kind of a cool background story. Okay, well, listen, thank you for joining us, Eitan. I hope you stay safe there. I understand you're graduating college soon.
Yeah, I have one exam left, and then I'm done.
Congratulations. That'll be a nice. You can take a nice deep breath when that's done.
Yeah, deep breath before I join the army.
Okay, well then it's another big leap. So congratulations and stay safe. And I'm going to post all this information and all the contact information. And
it was a pleasure speaking with you.
Okay, and thank you for sharing with us today.
Thanks for listening to the Ambulance World podcast at www.ambulanceworld.com. Please remember to like us on Facebook and sign up for our free newsletter and updates. If you enjoyed this podcast, please share it with your friends on Facebook and Twitter. Any questions or comments, please feel free to contact us at info@ambulanceworld.com. Stay safe and enjoy life.